All right, welcome, welcome, welcome. We're gonna start with doing what I love to do, what I always do, and that is breathe for a moment. Get in the room and just get our butt on the chair and our feet on the floor, and just relax a moment and let go of whatever you've been doing. And don't worry about what happens after this talk; it'll still be there. So let's just close our eyes and focus on our core and take some breath. Please mute yourself. If you're not speaking right now, we should have it all really quiet. So be on mute. Please mute yourself. Imagine that you have roots coming out of the bottom of your feet that go down to the core of the Earth planet. Connecting with your core to the Supreme Being through an invisible cord through your head. Please mute yourself to the Supreme Planet where Krishna resides. And breathe. And let us open our hearts and our minds to what we will hear today, that we will hear Krishna speaking to us through our speaker, and that we will also be inspired to speak from our hearts if we are in discussion. Let's invite Srila Prabhupada into the room as our original teacher. Nama Om Vishnu Padaya Krishna Prasaya Bhutale Srimate Bhakti Vedanta Swaminiti Namine Namaste Saraswati Deve Gaudavani Pracharine Nirvishesha Shunyavadi Paska Chadesha Tarine Jaya Sri Krishna Chaitanya Prabhu Nityananda Sri Advaita Gadadhar Sivasadev Gaur Bhaktivinoda Hare Krishna 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 Hare 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 Rama 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 Hare Hare. All right. So today we have the wonderful John Yasenchak, who's going to share with us his wisdom, and he's going to tell us a little bit more about himself. He's a clinical mental health counselor and addictions specialist. So John, you take it away. This is your spot.
Okay, so Hare Krishna, everybody. I see there's some familiar names on the screen. It's nice to see everybody. So let me just say right up front that I'm having a voice issue tonight. My voice, right here, there's some congestion down there. I don't know what that is yet, but I'll be clearing my throat probably a lot and sipping on my honey lemon ginger tea. So apologize for that ahead of time. But I've been working in the addictions field since about 1985. 86, somewhere around there, and in various capacities, worked in hospital settings, inpatient settings, outpatient settings, individual counseling that I provided. Worked on a Native American reservation here in the States for 20 years, and I've been teaching faculty in counselor training programs for the last 30 years, actually. I am also in recovery, so I'm a recovering person myself, recovering from alcohol addiction, and that dates back to about the same time, just a couple of years before I started working in the field, so I may be able to share something with you about that experience. So I do have some slides. I'm going to probably talk for about 45 minutes to an hour, and then we're going to stop the recording and open it up for discussion or questions or anything that might be on your mind. So we're asking that if there is any discussion points during my talk, that we not share anything personal until the recording is shut down at the end of the presentation. Okay, so I am going to bring up slides, hopefully. Let's see, next slide. Oh, no. Let me start over. Yeah. There we go. Okay. So a couple of years ago, I was in India, and that picture is the sun rising over the Ganga River in Varanasi. It's a bucket list trip of mine and Srila Prabhupada, Jai Srila Prabhupada, and I'd like to open right off the bat with some information about the Bhakti Recovery Group. So you may have heard of this group already. There is information about the group that gets talked about frequently on the podcast Wisdom of the Sages. And more recently, Jiva G has been traveling around the world, the universe, sharing information about the Bhakti Recovery Group. So this is the preamble, tells you what the Bhakti Recovery Group is all about. It's an all-inclusive, 12-step oriented, Bhakti-oriented fellowship for individuals who are recovering, interested in recovery from any type of addiction that binds our freedom, whether it be drugs, alcohol, codependency, recovering issues related to ACOA, adult children of alcoholics, and eating disorders, and various other addictions, including sexual addiction and pornography, as I'll be talking about a little bit later. The Bhakti Recovery 12 steps are listed here. And I'm actually going to stop this share right here and screen share the preamble and start by reading this. So I would like to ask if there is anybody out there who is familiar with this, who would like to read it.
I can read it, John. This is Shamamai here.
Okay,
Yeah. Okay.
thank you.
Okay. Oh, right from the top? Or
Yes,
just numbers? Okay. Bhakti Recovery Group and how it works. The Bhakti Recovery Group leads the way into a newfound life. These 12 steps are the foundation of our program. Our experience shows that when we work these steps with a sponsor, come to meetings on a regular basis, help another sick and suffering soul, we do recover. We ask Krishna to help us fully surrender to this program and to practice these principles in all our affairs. Number one, we admitted we were powerless over our addictions and associated behaviors, that our lives had become unmanageable. 2, came to believe that Krishna, a power greater than ourselves, can restore us to sanity. 3, made a decision to turn our will and our lives over to the care of Krishna as we understand Krishna. 4, made a searching and fearless moral inventory of ourselves. 5, admitted to Krishna, to ourselves and to another human being, the exact nature of our wrongs. 6, were entirely ready to have Krishna remove all these defects of character. 7, humbly asked Krishna to remove our shortcomings. 8, made a list of all persons we had harmed and became willing to make amends to them all. 9, made direct amends to such people wherever possible, except when to do so would injure them or others. 10, continued to take personal inventory, and when we were wrong, promptly admitted it. 11, sought through prayer and the chanting of the holy names to improve our conscious contact with Krishna, praying only for knowledge of Krishna's will for us and the power to carry that out. 12, having had a spiritual awakening as the result of these steps, we try to carry this message to those seeking recovery and to practice these principles in all of our affairs. Shall I carry on?
sure, if you'd like.
Honesty, open-mindedness, and willingness are all we need. We must remember that many of us have spent most of our lives trapped in various addictions to drugs, alcohol, sex, love, codependency, eating disorders, gambling, shopping, and many other dysfunctional behaviors. So we beg of you to be fearless from the very start. Our lives didn't become unmanageable overnight. So we learn patience and go easy on ourselves as we allow the 12 steps and Bhakti Yoga to guide us into this new way of life. We who have taken birth in the age of Kali are especially prone to the never-ending pursuit of material sense enjoyment in its extreme. Repeatedly, we continue the cycle of insanity, expecting different results. Bound and blinded by Maya, powerless over the threefold miseries, we run around life trying to fill that God-sized hole with material sense enjoyments, but the results were always the same: pain, devastation, and for some of us, even death. Many of us are practicing devotees involved in temple communities. Some of us may be reluctant to share that we struggle with addictions or associated behaviors. The Bhakti Recovery Group is a safe, anonymous space for sharing honestly. This is vital for our spiritual growth. We are born into this body with this diseased condition. This is our karma. We are not responsible for our disease, but we are responsible for our recovery. We fully accept this fact and work with what we have been given. By working the steps and practicing Bhakti Yoga, we become grateful for what we have, and slowly the veil of Maya lifts. Our outlook on life changes. We come to know that everything is by Krishna's arrangement, and we then begin to know a life free from the bondage of the false self. So keep coming back and don't leave before the miracle happens. Hare Krishna.
Hare Krishna, thank you so much for reading. Appreciate that very much. Thank you.
Thank you.
Okay, go back to the slides. Okay, so the those 12 steps that we just heard read are the 12 steps for the Bhakti Recovery Group. They're very similar, and they are based on, in fact, the 12 steps that come from the Alcoholics Anonymous tradition, which was established in about 1935, late 30s, early 40s. They're the same 12 steps that are in other 12-step programs, Sex Addicts Anonymous, Narcotics Anonymous, and all of these 12-step self-help approaches. So when I got sober, the way I got sober was by getting engaged with Alcoholics Anonymous and by working these steps. I've heard it said many times that these steps can be broken down into 3 sections. The first 3 have to do with surrender. Steps 4 through 9 have to do with cleaning house, taking care of our stuff, so to speak, and making amends where it's appropriate and possible to do that. Identifying our deep character issues that led to our addiction. And then steps 10, 11, and 12 are about continuing the practice and helping others. So surrender, cleaning house, and helping others. Pretty basic, pretty easy. I came to the Bhakti Recovery Group, I think about 2.5, maybe 3 years ago. I'm not really sure. I'm not that, I don't know how long ago it was, but it's at least two years and some months. And I found in the Bhakti Recovery Group a home, actually, where the principles of recovery based on these 12 steps are worked together with the practice of bhakti. And it's been just a really, for me, wonderful experience to be in that group. This we'll talk a little bit more about the Bhakti Recovery Group in the meetings that are offered online at the end of the session here tonight. This, let me just minimize here. Okay, so Chaitanya Mahaprabhu teaches us, I believe, how to practice Krishna consciousness and how to be in our Krishna consciousness. And this prayer that he is showing us how to pray here, this prayer I found in the Madhya Lila. And to me, this prayer speaks to those first three steps that we just read. Oh my Lord, there is no limit to the unwanted orders of lusty desires. Although I have rendered them so much service, they have not shown me any mercy. I have not been ashamed to serve them, nor have I ever desired to give them up. Oh my Lord, oh head of the Yadu dynasty, recently, however, my intelligence has been awakened. And now I am ready to give them up. Due to transcendental intelligence, I now refuse to obey the unwanted orders of these desires. And I now come to you to surrender myself at your fearless lotus feet. Kindly engage me in your personal service and save me. Beautiful prayer. So the world today is really challenging. As you know, there are many distractions that are out there that sort of take us away from our Krishna consciousness, from our awareness of the presence of God in our lives. And these might be, there's a list here of some of the things that do that. Certainly food, sex, drugs, gambling, news, gaming, texting, sexting, Facebooking, YouTubing, Instagramming, drinking, eating, diluting, injecting, freezing, snorting, freebasing, booting, huffing, streaming, and a host of all kinds of other distractions. So the thing about this list of distractions in Maya that are facing us today is that some of them have been there for a long time. Some of them are relatively new in the last couple of years, last couple of decades. A lot of them overwhelm the brain. So the brain that we work with, that we are embodied with in this world, is not equipped developmentally to handle many of these things on this list. They tend to overwhelm the circuitry of the brain. In regard to addiction, I love the first couple of chapters, the first chapter, especially in the Bhagavad Gita, where Arjuna, encounters a real crisis in his life. He's in this chariot with Krishna, in his kshetra, in his field of consciousness at the time, and he's faced with a dilemma. He's faced with a real problem, and he has kind of a meltdown, collapses into the chariot. And, before he does that, though, he kind of tries to get out of his situation. He has at least 6 different arguments that he uses to rationalize his position in his situation at the current time. Finally, as you know, he surrenders to Krishna. He surrenders, as step 3, to Krishna, to his teacher, his guru, his sponsor, to the divine personality. And then in the second chapter, at the end, you all know where this verse is located. Krishna, as the supreme counselor, the supreme psychotherapist, if you want, basically outlines the process of addiction and how it operates, contemplating the object of the senses. He's referring to desire, and the more that we desire, the more that our desires run rampant, the more we lift the level of dopamine in the brain, and as a result, we get habituated, we become attached to the objects of desire. And then from that place, the pleasure centers of the brain are hijacked, lust develops. And when we can't satisfy that lust, when we aren't able to fill that empty hole in the heart, if you remember the Rolling Stones song from the 60s, I Can't Get No Satisfaction, a lusty song, anger develops. And in all of the research on relapse, in all of the research on fall down for folks who are trying to maintain abstinence, in sobriety. Anger is the biggest trigger, is the strongest trigger. About 80% of individuals who go to treatment for addiction the first time when they come out relapse due to anger, mostly interpersonal anger, where the individual doesn't quite know how to handle anger, how to work with it, deal with it, express it appropriately. From anger, delusion or bewilderment of memory show up. Hence, discrimination is impaired. I can't think anymore. The prefrontal cortex of the brain is involved in this process. And when memory is bewildered, intelligence is lost. So the ability to make a decision, to make a choice based on intelligence, on buddhi, is totally shot here, totally gone. Judgment is hijacked, and I think I'm in charge. And when that happens, all is lost, and the person falls down into the material pool. So what does addiction look like? Well, addiction, first of all, and primarily, in my opinion, is the separation from God. Fundamentally, it's a separation from Krishna, our divine source, and it is, in my opinion, again, in regard to the modes of nature, the three gunas, probably the most binding experience that we can have. It involves, tamas guna, rajas guna, and sometimes sattva guna, but it is perhaps the most binding, most chaining experience that we can have. It involves obsessive thinking and compulsive use. Obsessive thinking, who am I serving? Am I serving alcohol? Am I serving drugs? Am I serving pornography? Who do I spend my time with? How do I spend my time? And then what are the compulsive rituals involved? It's well known in the addictions field that sometimes the rituals that are involved with using chemicals or using drugs, the preparation, for example, the paraphernalia that's used in heroin addiction, sometimes that is more reinforcing and attractive than the drug itself, because it's in the preparation, the rituals, the anticipation of using that the dopamine rush starts to occur in the brain. And the person, even before using, is chasing the drug, serving the drug, and practicing some rituals. Some people who struggle with caffeine, for example, have the ritual of drinking their coffee with a cigarette in the morning while they're reading the newspaper. And they develop a ritual around that, or they go out to a coffee shop, a cafe, to meet their friends and develop a ritual around that. So the rituals around our use are really important. It's important to think of them. Continued use results in poison at the end. It might feel good at the beginning, but in the end, it's obviously poison. So for many folks who are struggling with addiction, the use of the chemical, the use of the particular drug, does not bring a whole lot of pleasure when addiction swings into full gear. For many folks, it's a matter of needing the drug to avoid getting sick or to avoid the withdrawal symptoms. There's an inability to control or stop without help. So habits become characterological patterns, and those patterns move into addiction for many people. It's progressive, meaning that there's a buildup of tolerance across time. That means that I need more and more of the particular drug and chemical in order to get a buzz from it as I continue drinking or using. It always occurs, in my opinion, with some sort of mental health experience, and that might be depression, anxiety. It might be related to trauma. The use of the drug or the chemical might have its origin in an experience of early trauma or even later trauma, current trauma, and it might be used to medicate trauma. In a similar way, it may be used to medicate grief. A lot of people have a very hard time dealing with loss and profound grief. I think we all do. Physical, mental, emotional, and spiritual changes occur as if you imagine those as in Native American culture, there's something called a medicine wheel that's comprised of these four qualities. They all begin to fall apart. The wheel begins to fall apart. Very often it involves stigma, and the stigma around substance use is what makes it really hard for the individual to engage in treatment, to even go to a 12-step meeting, or to bring up the question of needing help in our communities, in temple communities. So the perceptions and the judgments that we have around addiction are culture bound in some ways. And when individuals are carrying the stigma, it can be very difficult to ask for help. And that stigma actually gets reflected in the language that we use when we talk about people who are suffering from addiction. So terms like, he's a drunk, junkie, those kinds of derogatory terms sometimes. People suffer from those terms, from the language. And I always use this example when I'm teaching, that there's a difference between saying John is a schizophrenic versus John is someone who is suffering from schizophrenia. Similarly, there's a difference between saying John is an alcoholic versus John is someone who is suffering from alcohol addiction. Now, I call myself an alcoholic, and people in the 12-step movement do, use terms like that as they self-identify with their disease process, and that's quite okay. But sometimes those terms can be used as stigmatizing factors. And finally, it's addiction is an attempt to fill that empty hole in the heart that sometimes starts actually in early childhood, sometimes in infancy. When the baby, the infant, the child does not get the loving attention, does not get the feeling of the arms of the parent wrapped around them, does not experience that loving gaze of the parent, and results in a feeling of emptiness that later on the individual may develop a pattern of seeking to fill that that emptiness with drug use or addiction or pornography, confusing that artificial feeling of bliss that comes from using with love, with the love that they desired as a child, or that the love that they did not get when they were children or infants. So this is a really short list of street drugs. I won't spend a whole lot of time on it, but I want to talk tonight about a particular narcotic. But there are three different types of narcotics. Opiates are plant-based drugs, opium, morphine, codeine. Semi-synthetic opioids are a combination of lab chemicals and opiates. And those drugs are drugs like heroin, Vicodin, OxyContin, Percocet. Might be familiar with that because dentists give that out all the time. Synthetic opioids, Demerol, Darvon, methadone, and buprenorphine. These last two synthetic opioids, these are drugs that are entirely lab-based drugs. But the last two, methadone and buprenorphine, are used actually in the treatment of addiction. And if we have time later, we can talk about how they're used. Depressants, benzodiazepines, alcohol, and barbiturates, three classes of very dangerous drugs, especially if they're mixed together. You don't see barbiturates out there very often anymore, but you certainly see a lot of alcohol and a lot of benzodiazepines. These drugs are anti-anxiety medications like Xanax and Klonopin and Ativan, and several others that are used to treat anxiety. They were intended initially for short-term use, but often people use them for years, and the dependency builds up, and they're very difficult to come off of. They have a major withdrawal syndrome attached to them, and people get very sick if they discontinue the drugs on their own without help. Each of those drugs has a different half-life. So Xanax, for example, about every 4 to 6 hours, people will begin to experience withdrawal symptoms, and they need the next dose of the drug in order to keep those symptoms, those feelings at bay. club drugs, MDMA, ketamine, and the forget-me-not drugs that are used to knock out women in bars and take them home, that sort of thing. Ketamine is on the streets, but it can induce a syndrome that pulls up old trauma, and that can be very frightening and scary. DSM is cough medicine. It's a drug that's in cough medicine, and kids like this stuff. I knew a person who was so addicted to DSM that she ordered it online in powdered form, and took tremendous amounts of the drug, mixing it with other drinks. Inhalants, these are solvents, gases, and nitrates, very dangerous drugs that a lot of kids use. Huffing, is a highly lethal form of inhaling. Stimulants, cocaine, methamphetamine, Ritalin. Ritalin is used for treatment with ADHD. Nicotine and caffeine. So cocaine and methamphetamine. Cocaine is a drug that once the brain experiences it, crack cocaine, it never forgets that high. And once a person is able to discontinue cocaine, there is usually a period of depression that the individual needs some help with for a year or two, possibly after discontinuation. Methamphetamine is a lab-based drug. The old labs were gigantic operations, big labs and buildings hidden far away in the mountains in certain areas of certain countries. But as some of you might know, methamphetamine production evolved into a shake and bake method where you pour the ephedrine, the stimulant, into a bottle and mix it with paint thinner and various other toxic chemicals, shake it, hoping it doesn't explode in your hands, and then form it into crystals. Very dangerous drug. Methamphetamine, actually prolonged use can destroy the brain's capacity to produce dopamine, which is essential for feeling good and meeting our basic needs. So long-term users of methamphetamine are very depressed very often and have a really hard time when they come off the drug, if they can come off of it, relating to a normal lifestyle. Nicotine and caffeine, these are socialized drugs. Nicotine is highly addictive. It has two components to it. One is physiological, the other is behavioral. And it's very difficult to quit nicotine. It might be the most addictive drug out there, actually. And caffeine, most people think it's benign, but 250 milligrams of caffeine a day, over that is considered kind of a toxic dose. And there are some research studies on the benefits of caffeine. There are some, studies that talk about the risk factors associated with it. We know in Krishna consciousness that Prabhupada asked us to refrain from all stimulant use, including caffeine. So hallucinogens, MDMA, psilocybin, mushrooms, LSD, these are actually back on the market. MDMA is ecstasy. Psilocybin, LSD are being used therapeutically now for the treatment of chronic pain, cancer, in late life cancer treatment, and in some places addiction. So it's kind of an interesting turn of events. And in cannabis, marijuana, used to be illegal in the US, go to jail, long time and behind bars. All of a sudden now, there's a legal marijuana store, just about every block down the street here from where I live. There's at least 5 of them out there. So that's a change in the cultural shift. Street marijuana has gotten more potent than it was previously, which is kind of something to be concerned about. A lot of people think of cannabis, marijuana, as a benign drug. Not necessarily true. It has developmental effects on young people, developing brains, adolescents, which goes up until about age 25, and then it can have other effects, for other people in terms of motivation and lethargy and a number of other factors. Alcohol consumption in the United States went up tremendously during the pandemic. So here are some data on alcohol consumption in the US. There were a lot of deaths that occurred due to liver disease and other issues. It's really hard to track alcohol deaths because sometimes people die in the hospital and the death certificate refers to liver disease, but it may not indicate that the cause of that liver disease was alcohol abuse, long-term alcohol abuse. In 2020, in this country, there were 92,000 Americans died from drug overdoses. These were opioid overdoses. The statistic from last year is over 100,000. Canada has been experiencing a similar issue recently, but not quite as intensely as the United States in regard to opioid overdoses. And there was a European study published in the European Journal of Psychiatry this past year that surveyed, I think, around 30 other countries, many European countries, and that research result indicated that opioids in the European countries, in some European countries, were on the rise. The use was on the rise. Two of those countries were the Czech Republic and England, and I believe Scotland. And in other countries, there was not so much of a increase, a slight increase, but not nearly as much as the United States. So opioids are drugs that impact the brainstem. The brainstem is responsible for controlling breath, heart rate, sleep, and those factors. That's why overdose is such a critical issue. Opioids are pain medications, basically. They're given and prescribed by physicians to manage acute and sometimes chronic pain issues. And what they do when they hit the brain is they move into the neurons receptor sites, the opioid receptor sites in the brain, kind of sealing those receptor sites so the natural opioids that the brain generates can't get in there. But they raise the dopamine level 2 to 10 times higher than it usually is, as a result of natural opioids and chemicals in the brain that produce pleasure. So that's what's responsible for the person chasing the drug and also getting all excited about the rituals, the expectation that a person has around drug use prior to its use is a result of this rise in dopamine from a biological perspective. The combination of dopamine and the endorphins in the brain create a memory. So it's like etching a program into the brain. The cells are actually changed with prolonged use, and neural patterns are developed in the brain that can last a long time. So even when a person quits using, the neural patterns may not fire up in the way that they did in the past, but if that person experiences a trigger, it is entirely possible that those neural pathways can get activated because they are still there. They're not as active, but they're still there to some degree. They get weaker as time goes on, as the person has more sobriety, but they remain. That's what contributes to relapse sometimes. So there are environmental cues that are usually related to dopamine. The brain adapts to the intensity by producing less dopamine in the receptor site. So when the brain is flooded with dopamine from synthetic drugs, when that happens, the brain goes into a toxic state. And the only way it knows how to deal with that toxic state, that flooding of dopamine, is to actually stop producing receptor sites. So the receptor sites are withdrawn. There are less of them around in the brain. The result of that is depression. So when the receptor sites are withdrawn, there's not enough of them to catch the natural influx of dopamine, and that person will feel a sense of blah. They will feel unmotivated. They won't find the things that used to give them pleasure pleasurable anymore, or for a period of time until the brain begins to heal itself. The most synthetic and most dangerous of these drugs that is out there right now, mostly in the United States, in Canada, as I said, in England, an increase in Scotland, an increase the Czech Republic really high, and in some other places in Europe. The drug that is most dangerous is fentanyl. And this is the drug that I feel like I have to tell people about all the time. This is a synthetic opioid that comes in powder form on the street that is 100 times more powerful than morphine. So that's a huge amount of narcotic, in that particular drug. So a couple of weeks ago, we had a drug bust here, not far from where I live. I think it was 2 pounds of fentanyl. That was several thousand doses of 2 milligrams, and it was enough to kill, a boatload of people in this area. So with fentanyl, what is happening right now is that dealers are mixing it with other drugs. They're kind of scraping it into pills and selling pills on the street and also on the internet. I raise this as an issue because although many devotees don't engage in drugs, but some have a history, as we know. The children are exposed to these chemicals on the street. And this past summer, I was in a meeting where the head of the United States Drug Enforcement Agency told us that that agency had confiscated enough illegal synthetic fentanyl on the streets in the United States to kill everybody in this country. And she also said that one of the biggest problems is that kids, adolescents who are dying from opioid overdose, fentanyl overdose, are getting their drugs online. So they'll connect with someone on Snapchat or one of the other social media sites who's selling pills and buy one pill. That pill, if it's laced with fentanyl, puts that adolescent at risk for death. And when fentanyl induces death, it does so by creating what's called a wooden chest. In other words, it affects the limbic area of the brainstem, and breathing stops. That's the main immediate symptom of fentanyl overdose. So it's a very dangerous drug, and there's a lot of it out there. And my opinion is that it's important to be aware of it because our kids are possibly exposed to it. If they're exposed to social media, there's a risk that they could be exposed to fentanyl. They could be exposed to it at the schools where they attend, and as far as general opioid use goes, many of the people that I worked with over the years, they did not start out as opioid addicted in their life. They got their prescriptions from a physician, a doctor, pain medication that they had to take when they experienced an acute trauma, and they got hooked on it. So it's really easy to get hooked on these drugs, and people, ISKCON, the population seems to me to be changing significantly. A lot of different people are showing up, in the communities, around the communities. And it's not at all impossible that someone might come into a temple who is using opioids and suffer an overdose. That's really right around where I live. This is not a heavy drug use area, but I ran into someone in a restroom a couple of weeks ago in a gas station who OD'd. I saw someone on the street downtown in the community I live in here, lying on the street, who had OD'd. So we just don't know where it's going to show up. The drug that counteracts fentanyl overdosing, opioid overdosing, is a drug called Narcan, naloxone, which is used for overdoses. This is what it looks like. And the way it acts is that when a person who has overdosed on the opioid is encountered, they're not breathing, they're turning blue, they're usually lying on their back. And you have a very short period of time to help that person. So this particular drug is administered through the nose. In a lot of states now in this country, it's available, at least here, it is available over the counter. It's kind of expensive, but there are programs that dispense it for free. So I carry this with me, usually, just in case. But when a person has OD'd and they're lying on the floor and they're not breathing, or they look like they're not breathing, and they're turning blue, the first thing that a person does who has this drug, this Narcan with them, is they just rub the person's chest really hard with your knuckles. If the person doesn't respond, you roll the person on their side, administer a dose of the drug through the nose. If there's no response, administer a second dose, and that will usually wake the person up. At that point, you step back, because when that person is woken up, they're usually angry, because what this drug does, what Narcan does, is it kicks out the other opioids that are in the cell receptor sites in the brain. So if there's heroin in the brain, or if there's fentanyl in the brain, this drug will kick that drug out of those receptor sites. So it induces something called precipitated withdrawal. So the person is immediately in an acute withdrawal state at that point. And it can be very upsetting for that person to wake up that way in withdrawal. At that point, you have 30 minutes to get that person to the hospital, just about 30 minutes before the person needs another dose of this drug or immediate treatment. So I just wanted to share this because I am just so concerned about the availability of this drug out there and the way it's marketed, through social media, and the exposure that our kids might have to this drug, and the fact that we really need to educate people about this chemical, how it works, the dangers of it, and the availability of it. So moving into a discussion of behavioral addiction, the internet here. One of the things that I always ask people to think about when I do some trainings around internet addiction and ethical use of the internet for clinical counselors, but one of the things I always ask folks to think about is, what is your relationship with technology? This is an incredible device. We take it for granted. When I was in school, so I'll probably give away how old I am, but the computer that I had to do my statistics problems on was in a gigantic room that was air-conditioned, freezing room. The computer was a huge box in the middle of the floor, and I had to take punch cards, a stack of punch cards, to run my statistics problem through that computer. Today, everything we need is in this little device that we carry around with us and take for granted. This is a highly developed technological tool that sometimes we use without thinking about what is going on the other side of that screen. And so I can't spend time getting into how these devices are used, or how beneficial they are for us. They are obviously beneficial, but there are also some questions, about how we use them, how much time we spend on them, and does that constitute an addiction, for some people. Lemke calls this the modern hypodermic needle. It's pretty interesting, delivering digital dopamine almost 24/7. Should be 24/7, not 24/6, unless you take a day off during the week and put your cell phone in a closet. So in regard to pornography, there are a lot of different definitions of pornography out there, and the literature on pornography is really vast, and in some places conflicted. Obviously, that there are some people that promote pornography and think that it is not such a problem. In fact, there are some that think it is therapeutic in some circles, And of course, there are others, and I am in this camp that think believe pornography is very, very detrimental. So you often hear the term porn used a lot, and I don't like to use that term because it kind of minimizes the impact of what we're dealing with here. It makes it too familiar. I watched porn last night, or it's been a week now since I watched porn. Maybe I'll do it tonight, but it just is too familiar. And to me, it lessens the impact of what pornography actually is. So this is a definition I came up with. First of all, portrayal of nudity and sexually explicit material through a variety of cultural medium, music, art, architecture, a lot of different medium for the purpose of arousing sexual pleasure and satisfaction. But unlike other stimuli that we normally deal with, I mean, pornography is not like a chocolate peanut butter cup, that produces an immediate response of dopamine. It's not like a nice warm dish of khichdi, your favorite khichdi, that produces a response and hopefully gratitude for Krishna providing this for us. No, pornography is what's called a super stimulus. It is the intensity of pornography, the intensity of it, that produces problems, produces addiction, produces actually changes in the brain that have been documented in research. So the fact that I can bring up little screens like YouTube clips, maybe 6 at a time on my screen or 8 at a time, and look at one for 10 seconds, click it off, look at another for 10 seconds, click it off, look at another one for perhaps a half a minute, click it off. It's that clicking of the intensity, the intense stimulus, the intense visual stimulus that actually is responsible for distorting the brain. Literally has a literal physical impact on the brain. So it's that intense distortion. The internet is like that to some extent. We don't have time to get into that. But the internet, sometimes acts as a super stimulus. Pornography, however, really meets the definition of what a super stimulus is. It's demeaning to the dignity of persons. It creates an illusion in the mind and brain. It creates an illusion. The brain responds to these intense images that go flicking by it in a way that creates the illusion that yes, I can have that. Yes, this is like ultimate satisfaction. I can have one person after another, after another, after another. The physical, instinctual, lower base of the brain reacts to pornography in that way, and that is responsible for the illusion that it creates. It also creates the illusion of these are perfect people. They look beautiful, they look great, they look their action, what they're doing is stimulating. I feel pleasure watching it, and all of that is an illusion, in the brain. It teaches exploitive relationships. Mostly women, are often seen to be victims of pornography, but we also know there is, males. There are male actors that act in these movies and films, and it becomes increasingly violent and bizarre over time. It gets really twisted over time, and you remember that principle of tolerance that I mentioned. If a person crosses the line into addiction with pornography, tolerance will build up. And the initial buzz that I get from watching these videos intensely, over time, if I continue to repeat that pattern, the need that I have for more intense stimulation will become greater because my tolerance will be increasing. Therefore, my interest will evolve into pornography that is increasingly violent, involving scenes of choking behavior, domination, a whole variety of really, bizarre things that may include animal bestiality and a whole range of things. I mean, it can progress, to that level as a result of the progression factor in the brain. It becomes a habit, and then for many, the habit can cross over into addiction. So, sometimes a person has to make the distinction, figure out how is this impacting me. Is this a habit that I can change easily? Can I associate with my devotee friends, talk about this to someone, with my counselor, my guru, someone that I can open up to about it and work on changing this habit? Or has it crossed over into an addiction where I'm very secretive about it, where it's actually impacting my marriage? Divorce rates are high as a result of pornography addiction. It's impacting how I relate to my children. I'm not going to work because I'm up all night on the computer, and things are really starting to go south and to fall apart. My life is falling apart. Not only that, but when I stop using the pornography, I get sick. because there's a withdrawal syndrome associated with it. I begin to feel physical symptoms. Anxiety goes up. I may have the sweats. I may start to shake until I get my next fix. So there's a really big difference between habit and addiction that some people need to think about and reflect on. Pornography's progression over the years, when I was a kid, there were only magazines in the back of, newspaper stands. That 12-year-old boys like myself, would go and check out, and we of course didn't know what we were even looking at, because a child, that's exposed to pornography, and today most children are exposed to it by at least age 10, 12, certainly by age 14, on this device that we carry with us, or another little device, computers and tablets. But back then we didn't have that. We just had those magazines, and kids at that stage of development look at the images and they have a physical sensation. There's a physical sensation, and it's overwhelming because it's a super stimulus even for the kid, and the kid doesn't know what to do with it. What is this feeling that I'm having? First of all, I don't have the language at that point developmentally to describe it. All I know is it feels good, whatever it is. And I don't know what to do with it. So without a mentor, without an adult in my life to help me figure this thing out, what the heck is this that I'm experiencing? I could develop, a habit, which could then later on down in life become an addiction. That mentorship, that adult stepping in, and mentoring and educating the child is really important. Started out with magazine and books. It evolved into movies and music, and that eventually became videotapes. Remember those 8-track tapes? I remember those, and also the VHS tapes that were in stores, pornography stores that sold them. That eventually evolved into DVDs, which made rentals possible, and purchasing less expensive. And that, evolved into the YouTube model, tube videos, these are called, which are these short videos that people act in to produce, and also that amateurs upload. People in their bedrooms just take pictures and upload their videos to some of these sites. The slow videos that were produced in videotapes and DVDs evolved into high intensity delivery. I can put 8 images on my screen or more, possibly at the same time. Now I can carry it around in my pocket if I wanted it, on my phone, easy. In the future, not too distant future, the next step in evolution here will be through artificial intelligence and virtual reality. So eventually, the images are going to jump off the screen and be right here in the middle of my room as a hologram. Or they're going to be in that virtual reality that everybody is wearing on their face, the virtual reality, systems that certain social media companies are now promoting and putting on the market. So when people talk about pornography, they say it's affordable, accessible, and anonymous. It is not anonymous. Every time you go online, we need to know and realize that every time we go online, every time you do a Google search, every time you go to a porn site, your IP address is recorded. Not only that, but what you type in, what you're looking for, the data that's collected is incredible, by these companies, very sophisticated data collection. Regular companies do this all the time, as you know, and use the data to market and to create what they call behavioral profiles. They want to know how you use the internet. So the pornography companies, companies like MindGeek, have mastered this technology of data collection for the purpose of creating more intense websites and targeting their market. I didn't mention how I got interested in this. It's not that I got interested in it by watching pornography, this topic. I got interested in this because one of my first jobs in the profession I'm in was working with individuals in Times Square, runaway kids, who actually came into Times Square. I was at a shelter We housed, the shelter welcomed 10,000 kids a year at that time. And the idea was to give them at least 5 nights of a bed and some food, and then hopefully get them out of there. But when they got to Times Square, the pimps on the streets were right there ready to pick them up. And many of these young kids, 12, 13, 14-year-olds, got involved in the prostitution and pornography industry. So I saw this firsthand in my first, counseling position. There was a lot of sex trafficking right on the streets, parents selling their kids, and various other horrible things like that. Anyway, in the media, we have some cases now that people are exposing. The company that is really big is called MindGeek, and it's home for sites like YouPorn and a couple other pornography sites. But as you can see, 3.5 billion visits a month. That's a lot of people logging into their internet site. $97 billion a year in 2017 compared to Netflix's measly 11 billion. These are companies that monetize childhood rape, revenge pornography, spy cams, racist content, and interestingly enough, they are charitable. They donate to some organizations to fight for racial equality, etc. This was exposed by Nicholas Kristof. There's been some publicity about a court case where a 13, 14-year-old was videoed by her boyfriend, and the video was put online. It went into MindGeek, one of their websites, and it went viral. And she tried to take it down, and of course, it kept showing up everywhere. She got older, it became significantly problematic. So she sued the company. It went to court, and as of August, I believe, was the last time I heard about this, 2 months ago. The case hasn't been settled, I believe, against the company itself, but Visa and MasterCard pulled out because they were included in the lawsuit in terms of being related to child pornography. So really kind of interesting stuff. Some statistics there. Most interesting statistic here is that men are not the only users of this. This sometimes surprises people. But there are a significant number of women out there who view pornographic websites. Brain, the back of the brain, lower brain is the one that is interested in eating and procreating. The front part of the brain is the one that puts the stops on our drives and our instincts. But the drugs and the pornography, the superstimulus hijacks the prefrontal cortical area, making it really difficult for a person to put the brakes on and to actually stop using. So how does this work? I mean, what are there are 4 steps that people talk about in regards to the brain's response to the superstimulus. And these steps are called sensitization, desensitization, hypofrontality, and the prefrontal cortex, and then a compromised stress response. So sensitization means that the brain is just getting used to the stimulus, whatever it is, and there are pathways in the brain that are beginning to respond to the stimulus and beginning to develop. So neural connections are beginning to develop in relation to the stimulus in the brain. Desensitization is the result of dopamine flooding that I was talking about earlier. It's responsible for increased tolerance. It caps at depression. So a lot of users of pornography sometimes suffer from depression. This is the reason why. This is reversible. The dopamine receptors do grow back, but it takes a little bit of time, 3, 4, 5 months sometimes. Frontality, the control center of the brain, problem solving, regulation, being able to evaluate the consequences is affected in this area. Brain fog, anxiety, impaired memory show up here. Less control when faced with desire. Why is that? Well, it's because that area of the brain actually shrinks with continued use. This was identified in a study in Germany. In 2014, there have been numerous studies that replicated this and have looked at this fact that continued heavy use of pornography actually impacts the brain by shrinking the prefrontal cortex, therefore making it more difficult to control the behavior. And of course, it affects the compromised stress response system. So the way in which I picture this is that sensitization is kind of like this. Imagine that you have a new job and you're driving to this job every day along this road. And as you go along the road, you notice the trees, the houses, the dogs, the cats, the flowers. It's so beautiful driving to work every day. But at the end of the road is your paycheck. And you become focused on that. That's called sensitization. So now your brain is developing a neural pathway. You can drive to that job without even thinking about it. You can drive thinking of something else. You can drive while you're singing. You can drive while you're chanting. As you go to the this source of stimulation. Desensitization starts to happen when I stop noticing the trees, the flowers, the house, the beautiful dogs and cats along the road, and I'm so hyper focused on that stimulus now that my neural receptors, because of dopamine flooding, I'm not really noticing anything else anymore that brings me pleasure. And that's a problem, because when I take time off from the job or when I get fired, I'm going to be lost. I'm going to go into a really deep depression, hyperfrontality. I can't stop, can't control myself. That's really difficult. And then I learned to use this behavior to soothe myself. When stress comes up, it becomes a self-soothing behavior for me. So there's the illusion, there's the impact on devotional service, there's health and mental health, effects. There's an effect on social education of kids, an impact on literacy, media literacy. How do we deal with it in education? How do we talk to kids about pornography? The right time and the right place is really important. You can't talk to your child about pornography when you're on your way to a school event or that's exciting for the kid, a Halloween party the other night, a sporting event or that type of thing. But maybe you can, because if you do it in the car, you got your kid in the car. And it's kind of like an enclosed environment where there's some anticipation of fun, but it's just you and her or you and him in the car right now. And that might be a great place to bring it up. Try to avoid shaming your child. If you find any links on the computer or evidence that the child has been viewing pornography, you have to decide what you want your kid to know, what you want your children to know. And of course, what we want children to know is informed by Shastra, to a great extent. Don't be afraid to start the conversation. A lot of people are afraid to bring it up. Got to be clear about the rules, self-searching, safe searching. How do you do that? And address curiosity. So the best way to deal with this is really not to get all anxious or bent out of shape about having an open and honest conversation with a child, with kids. Most kids, if not all, can handle it. And you just have to find the right time, not be shaming, the right place, and the language that you need to use to address. How can I help? Well, one way of helping a person who is suffering from addiction is to be compassionate and present. Another way is to, realize that people don't ask to become addicted. I have never spoken to anyone who said to me, I always wanted to be addicted when I grew up. I had never heard that as a goal in life. What happened to the person, rather than why, something happened. So having that question, that consciousness about the individual, it might be trauma, it might be some other event in their life, a loss, something happened to that person, something might be missing, sensitivity to that issue. Physical and emotional pain are experienced in the brain, same areas of the brain, that's an important thing to be aware of. The rules that some people grow up with in their families, don't talk, don't trust, don't feel, sometimes get carried over into adult life. And when they do, they become quite dysfunctional in our relationships with people, But we may notice that someone is withdrawn. They don't trust me. They don't trust. They're not getting along with people. And they may have been told when they were growing up that they can't express their feelings. You can't show your tears. If you cry, I'll give you something to cry about. So that programming might be embedded there. I've heard people say, I'm not afraid of dying. I'm more afraid of living. If they don't love me, maybe they will need me. And you get into the whole codependent kind of lifestyle. And lastly, if you think someone is suicidal as a result of addiction to any of these issues, behavioral or drugs, ask the question, and some people avoid it. They kind of dance around the question. Are you okay? Are you thinking of hurting yourself? Both practice and the research, indicate that it's best to be direct. Are you thinking of killing yourself? And then you can explore what you need to do to help that individual. People can handle that question, and actually most people appreciate being asked. And then knowing, what the resources are in your community, spiritual, medical, emotional, and other resources that are out there. So I'm going to stop here. Rambaru, can you turn off the video?